Hi, everybody. I'm back. I'm Jessica. I'm a functional nutritionist, and I'm super excited to continue doing these open office hours or PowerPoint presentations and just sharing all my information that I learn and things that come up along the way. I like to call this our Nutrition Power Hour. It really allows me the opportunity to share on new knowledge that I've learned or new methods or food approaches, and really just be able to help us understand our own bodies, not just from a medicine perspective, but a nutrition perspective and how this really interconnects and intertwines. So today, we are going to talk about the interconnected web that our body is. And I know that our last presentation, we really talked about what is functional nutrition, what can you expect. And so now I really want to tie that into, when we really listen to a patient story and we kind of go down the timeline and put all the puzzle pieces together. There's also that concept of looking at you as a whole person. There's so many people that have a primary care physician, and then they've got all their different specialists, their endocrinologists, their gastroenterologists, and those doctors are amazing. They really are. But a lot of times they're not connecting all the puzzle pieces because they're all working on one specific area. So if we can really tie in and have a better understanding of how the body works as a whole, I think that's really one of the missing links with chronic disease and inflammation and really knowing what the root cause of something is. So with that being said, let's go ahead and get started. I know I briefly touched on this last time as far as possibly some upcoming topics, and I may try to stay with this curriculum, or I may not. I might try to switch it up a little bit and throw a cooking class in there or something like that. But I did want to build some foundation first. So the why behind looking at the whole body in relation to health concerns. That's really what we're going to talk about today, the why behind it. And, why do we look at the whole body? How is this interconnected web playing a part in our disease states, our symptoms, what we're, experiencing symptom-wise with inflammation? And so really, why the whole body approach? Well, I love the Institute for Functional Medicine, so we're going to tie that back in. If we use the functional medicine matrix from the Institute for Functional Medicine, which I will show you, this really allows you to see how there's so many different systems within the body that create this interconnected web of all of our organ systems and really what needs to be addressed and identified when we work with a patient. If we think about it, a lot of times practitioners will go back to the gut. And the main reason for that is that it's not some fad or, oh, everything's about the gut right now. We got to look at that. It's truly because the gut hosts 70% of our immune system, if not more. And our immune systems have the ability to cause inflammation in our bodies. And there's certainly different hormones that interact within the immune system that can release pro-inflammatory cytokines, which creates inflammation. And what we eat affects our gut. And so there's a lot of different puzzle pieces there that our gut controls or is affected by that we really need to be mindful of. So when the gut isn't on track, all of these different areas can be affected. So this is the Institute for Functional Medicine matrix. And what I wanted to show you here is in the white box, you'll see that there's different areas. It says assimilation, structural integrity, communication, transport, biotransformation and elimination, energy, and defense and repair. And then right in the center, you've got your mental, emotional, and spiritual, because that's just as important as looking at all these different areas and organ systems. So if we look at assimilation is really looking at GI health. So are you digesting properly? Are you absorbing properly? Is your intestinal lining, your barrier function, is that, intact and working well? Or do you have some leaky gut where your tight junctions are separating? And then structural integrity is our barriers, what our body uses to protect ourselves. It could be gut, it could be skin. That is our barrier function and the integrity of that. And then you have communication, and communication is things like our neurotransmitters, our hormones, the cytokines within our immune system, things that communicate with each other that then create a response in our body. Transport is our cardiovascular and kind of our lymphatic system. And then you've got biotransformation and elimination. This is our ability to detoxify from toxic elements. And it could be toxic elements such as food, it could be hormones, it could be built up chemical or environmental toxins. It's really the ability of our body to flush those things out and be able to eliminate any type of toxins within our body. And then energy definitely goes back to mitochondrial dysfunction. So the mitochondria is our powerhouse where we produce all our ATP and our energy that our body needs. So if there's problems there, there's usually some dysfunction with mitochondria. And then defense and repair is our immune system. What really wards things off when we get sick, or if we get a cut, what heals us. So, that defense and repair mechanism and how that all plays out. Okay, so we're going to go through some of these. I won't go through all of them, but I wanted to go through some of the key ones and discuss that. And assimilation will be the first one that we talk about, which again is the GI tract. So the GI tract produces 3/4 of our neurotransmitters. There's a lot going on within the gut, and I know that we talked about this on the last slide, but I wanted to highlight that here and show you, okay, we've got our neurotransmitters. So those are within our brain, we've got GABA, we've got dopamine, serotonin. So all of those things that kind of shift our mood. And then we have our immune cells, and our immune cells in our gut host about 2/3 of our immune cells, so about 70%. And so that's when I was talking about our immune system and how that's, such a huge part of that. Our gut also has 10 times more cells than our entire body combined. If you think about that, is just mind-blowing to think about. And this is why the gut is so important. So if you think about our entire body, our gut has 10 times more cells than that. That's crazy. It has more metabolic activity than the liver, which is also a big deal. The liver is where a lot of our metabolic activity happens. And it also houses a genome that is 100 times greater than the human genome. So the GI tract is a phenomena in itself. It is just this huge aspect of health and wellness. And that is why when people have gut disruptions, they might have mood shifts. They might have autoimmune develop. There's all these things that can happen when we have gut disruption. And so that's when you'll see, like I put down here, links. You've got depression and mood disorders, autoimmune and metabolic diseases and disorders. So these are all things that can develop by having a GI tract that is not well intact and not performing properly. Then if we look at our defense and repair, so this is our immune system again. If we get a wound, our body goes and right away starts to try to, clot the blood and get everything working and healing properly. Or if there's an invader or toxic component, maybe we eat something from food poisoning, our body's trying to work hard to get that out of our system. And so we've got our innate immune response, which is our fast response to things. And then we have our adaptive immune response. And overstimulated innate responses can lead to chronic inflammation. And so you could see that if there's disruption within the gut, where our immune system is, most of it is hosted there, then you could see how inflammation could be created there because you're overstimulating the innate response within the immune system and causing chronic inflammation. Chronic inflammation can lead to things like diabetes, arthritis, heart disease, fibromyalgia, the list goes on. It can also lead to cognitive and psychological shifts. So when we talked about mood, depression, dementia, ADHD. And this could be due to, having that overstimulated innate immune response could be because of reoccurring infections. It could be due to gut dysbiosis, and gut dysbiosis just means that your gut is unbalanced. You've got poor bacterial balance within your gut. You might have some leaky gut in there. Your tight junctions are coming apart, which means that pathogens and bacteria and food components that you're eating can pass through without going through that is this okay barrier. Chronic and emotional or physical stress. Stress on our body is such a huge component. I talk to patients all the time about stress, and I feel like it's still not something that comes through a lot with patients. We get really tied up on our physical aspects of how we feel, that we're not very mindful of stress, and stress can have such a huge impact. I love talking about stress because I can't stress it enough of how impactful it can be on our body. Elevated glucose and insulin levels, those can create your innate immune response to be overstimulated, leading to chronic inflammation. And so that's why a lot of times I'll work with people on blood sugar stability. Even if you're borderline, sometimes people won't have necessarily, diabetic or even pre-diabetic A1Cs, but they might have really high glucose or elevated insulin. And those are things we need to work on to make sure that that doesn't then create a chronic inflammatory response within the body. Okay. Biotransformation and elimination. This is our body's ability to detox. This is our liver. So detoxification does happen everywhere, but 95% takes place in the liver. And so there's other places like the GI tract, the lungs, kidneys, skin, the blood-brain barrier, but it's minor amounts that happen there. The bulk of it happens within the liver. And there's certain things that affect detoxification. Age is one of them. As we get older, our detox pathways don't function as optimally. And so that's something we have to be mindful of. If we're seeing patients that are, aging, we want to make sure that, are you detoxing properly? Because this is something that naturally occurs as we start to get older. Gender plays a big part. The estrogen and progesterone ratio, and the CYP enzymes used in detoxification can affect how things detox. So there's a certain enzymes that are called, I won't get into the technicalities of this, I don't want it to be too confusing, but there's certain enzymes called CYP enzymes that are used in detoxification. And the estrogen and progesterone ratio can impact that. So depending on your gender, that can impact this enzyme activity, which in turn affects our detoxification. Certain gene variations or alterations. Diet. Here we go with nutrition, diet, and even, lifestyle. So if we're looking at cigarette smoking or even doing barbecue, here in the US, we love to barbecue, but when we think about that, the charred meats, they increase phase 1 and not phase 2 of our liver detox pathways. And what happens is when you have something come into your liver that needs to go through detoxification, and this even happens with hormones like estrogen, phase 1, it goes through phase 1, and then after phase 1, that component is actually more toxic than when it first entered into the liver for detoxification. So if it doesn't go into phase 2, that's bad, because it comes into the liver, it goes through phase 1, now it's more toxic than when it first started out. It needs to go through phase 2 to now decrease that toxification again, and then through phase 3 to eliminate through, our feces or our urine, sweat, things like that. But if we're not going to phase 2, then you're left with these really toxic components that now create oxidative stress in your body and inflammation. And so things like cigarette smoke, charred meats, those increase phase 1 and not phase 2. So these types of foods and lifestyles can really make toxic components, and now those are floating around in your body causing inflammation. Environment, whether it's, work or home life, hobbies, personal habits, perfumes. Perfumes are endocrine disruptors. They can affect our detoxification pathways. They are toxic to our body. I used to love getting perfume for Christmas. When I was little, I would get, the Victoria's Secret brands, or I'd really like to get Marc Jacobs or something like that. And that was my big present. And now that I'm more knowledgeable on these topics, I go, wow, people just don't understand that certain things that we just think are normal and not a big deal can have huge impact on our bodies. And perfumes is definitely one of those. Medications. So SSRIs and some antibiotics inhibit phase 1 enzymes, so disrupting that pathway again. And just to clarify again, there's 3 different phases within the liver detoxification. And if we don't get through phase 1, things are more toxic. We really need to go through the full detoxification process. Disease. So liver-focused diseases impact proper detoxification. Nutritional deficiencies. So if you have chronic diarrhea, or you're not digesting or absorbing properly, and you're not getting all those nutrients from whether it's your supplements or your food, these are affecting your different liver detox pathways. So not only are you not getting nutrients to feed the rest of your body from your food, you've got, maybe chronic diarrhea, so you've got gut disruption. The gut disruption is now going to be causing problems with, your immune response. And now it's also impacting liver detoxification. So any type of food, pathogen, bacteria, any type of toxin that's coming through, your body's not being able to properly detox. And as I just mentioned, gut dysbiosis. So when your gut is not intact, you've got intestinal bacteria that can play a role in the detox process now and impact that. And then again, stress, one of my favorite topics, stress, emotional trauma, high sugar and low protein diets. There's so much that plays a role in how our body detoxes that, what we have to realize is that there was a study done on infants coming out at birth and looking at their toxic levels just from birth. And babies had over 200 different toxins already within their system that were coming through from the mother. And so what we have to realize is that, we all have toxicity in us. So, I mean, the world that we live in is toxic. It is. Whether it's coming from the air, the water, the food, our daily lifestyles. I mean, we have toxicity within us on a daily basis, and a lot. But it's really when our body gets overloaded and we've got poor diet, poor lifestyle, chronic inflammation, that your body just starts to topple over and it goes, I can't take anymore. And that's when we start to see problems. So what we have to realize is that, yes, we're not going to, be able to remove all toxic components from our life, but if we can really be mindful of these things and, focus on a nutrient-dense nutritional approach, make sure that our stress is being controlled well by doing mindfulness techniques or self-care, self-love. All of those things can play a part, and they're little things that are just going to keep your body in a good place. All right, energy imbalances. This was one of my favorite courses I took within my master's program, was all about the mitochondria, and it's such a fascinating component of our bodies. It's most commonly known as the powerhouse cell, powerhouse of the cell. It's where we, produce our ATP for energy. But there's so much more that goes on in the mitochondria. It's fascinating. But certain mitochondrial dysfunctions or manifestations can present in things like Parkinson's disease, chronic fatigue syndrome, of course, because we're not getting that energy, Alzheimer's, neuropathy. It can also lead to reactive oxygen species, which can cause havoc and damage our cells. So reactive oxygen species are basically stress in our body. They create these toxic cells that are components within the cell that can start wreaking havoc, and they damage our DNA, they disrupt enzyme communication. There's a lot of things that these do, and we do not want those. We have them in our body, but our body converts and combats those with proper diet, lifestyle, things like that. So when we have lack of diverse diet to really provide nutrients that we need for the function, that can cause dysfunction in our mitochondria. Physiological stress, medications, environmental pollutants. These are all things that can also wreak havoc on our mitochondria and lead to reactive oxygen species. I wanted to show you this. I think it's really important to see how many vitamins and minerals and antioxidants in general are needed for proper mitochondrial function. It's a ton. It's a lot. I mean, look at this. We've got copper, zinc, B vitamins. And when you think of B vitamins, there's a lot of B vitamins. You got B1, B2, B3, B6, it's like the list goes on. So there's multiple B vitamins, magnesium, CoQ10, iron, carnitine, selenium, vitamin C, vitamin E, glutathione, alpha lipoic acid. And there's more. These are just the main ones. So if you think of the fact that your body isn't getting nutrients if you have gut dysbiosis and you're not digesting or absorbing properly, like I said, whether it's from food or supplementation. Not only is that now affecting your gut and your liver detox pathways, because we need nutrients for that, but now look how it's affecting your mitochondrial function. And if we don't have proper mitochondrial function, we talked about specifically on the last slide here, you can get Parkinson's disease, chronic fatigue syndrome, Alzheimer's, neuropathy. I mean, the list goes on and on. Those are just a couple of the few top ones, but mitochondrial dysfunction can, exercise intolerance. There's so many things that it can cause that this is really, really vital. Even our hormones, our sex hormones are developed from cholesterol within our mitochondria. And so if you don't have that, now your hormones are off. So there's all this interconnected linking of how one area of our body can affect another. And so I just wanted to show you that to show how many vitamins are actually needed. Vitamins, minerals, nutrients are needed to really have proper mitochondrial function. Okay, so now we've got the communication. This is our hormones, our neurotransmitters, the things that really talk to each other within our body to create a response. And so I was just talking about sex hormones and how they need cholesterol to be synthesized, which happens in the mitochondria. So you can see if you're having mitochondrial dysfunction that you're not getting proper communication within your body with your hormones, because you might not be producing those sex hormones that are needed. Sex hormones bind globulin and is what binds our sex hormones. And so if we look here, there's certain things that can impact the binding, what's considered bound, and then what's considered free hormones, and what we can actually utilize. If it's bound, we're not utilizing that. If it's free, we can utilize that within our body. So if you look at sex hormone binding globulin, which again is what binds our sex hormones, hyperthyroidism increases sex hormone binding globulin. So that makes less available free hormones for your body to use. Hyperthyroidism, so you've got an increase in thyroid function within your hormones there. Caffeine increases sex hormone binding globulin. So those of you that are drinking 2-4 cups of coffee a day, even tea, black tea and things like that, it can be good in moderation. But if you're drinking a lot of that, that can increase this sex hormone binding globulin, again, creating less free hormone for our body to really utilize. Hypothyroidism can decrease sex hormone binding globulin. And what's important here is that you need to have balance. You want to have your free hormones and then you want to have your bound hormones. And so if you're decreasing and increasing this sex hormone binding globulin, you're creating an imbalance within your free and bound hormones, which is not what we want. We want that to kind of be in balance in a state of homeostasis. And so you've got your hyperthyroidism increasing the sex hormone binding globulin, and hypothyroidism decreases that. High insulin levels decrease the binding globulin. So low sex hormone binding globulin is actually a marker for insulin resistance, and it's also a predictor for type 2 diabetes risk. So that's something that we can look at to be indicative of those things. Obesity decreases sex hormone binding globulin. High testosterone levels will decrease in sex hormone binding globulin. Estrogen increases HDL and triglycerides. So if you think of how the sex hormone binding globulin, if we're having imbalances between our bound hormones and our free hormones, and then if you see here that we've got estrogen increases HDL and triglycerides and decreases LDL, to an extent that's good. We want our HDL to be higher, but we certainly don't want our triglycerides to be higher. But you can see how our hormones also play a part in our lipids. Adrenaline, stress can decrease our estrogen levels. So we've got not only lifestyle, but nutritional components that are affecting the way our hormones and our neurotransmitters are being able to interact and being available throughout the body. And I wanted to show you this. The Institute for Functional Medicine has really great handouts. This is one that I just wanted to show you. So factors that affect the thyroid function. So what happens is our TSH creates and makes T4. And T4 then splits into T3 and reverse T3. And we want more of the T3. We don't necessarily, I mean, you have almost similar amounts of reverse T3 and T3, but you want the T3 is what's usable by our bodies. So if you look on the left side there with the red font, you'll see it has the factors that inhibit proper production of thyroid hormones. And it's really stress. Again, I can't stress it enough. Stress is a huge component. Infection, trauma, medications, fluoride, certain toxins like pesticides or mercury from too much, maybe you're eating a lot of fish, autoimmune diseases, things like celiac, and then factors that increase the conversion of T4 to reverse T3, which again, what is usable by our body is the T3, not the reverse T3. So we don't want to increase that conversion to reverse T3. So things like stress, trauma, low-calorie diets, inflammation, that cytokine in immune response, toxins, infection, liver and kidney dysfunction, and then certain medications, of course. So you can see how nutritional approaches with food, how lifestyle with stress management, all of those things can play a part. Even exercise and movement helps decrease inflammation within our body. So there's so many things that play a part just that we can have control of within our day-to-day life. And so I really love looking at these handouts because it really has the opportunity to show, look, these are things that are modifiable by us. We just need to make better choices within our life that really create this happy place within our body to where we can utilize our hormones properly. And then you'll see on the right-hand side, so these are things that really contribute to proper production of thyroid hormones, which is, again, a lot of nutrients. So we've got iron, iodine, zinc, selenium, some B vitamins, vitamin E, C, D, and then proper conversion from T4 to T3, selenium and zinc, and then factors that improve cellular sensitivity to thyroid hormones. So we've got, vitamin A, exercise, like I was just talking about, zinc. So if you think, again, let's rewind. If you go back and you go, okay, I've got really bad gut dysbiosis right now, or my gut is not in a good place. I've got bowel irregularities. I feel like I'm not digesting or absorbing my food well, so I'm not getting those nutrients. This is affecting my liver, so I'm not being able to detox properly. Now it's affecting my thyroid and my hormone capabilities because look at all these nutrients that are needed. I've got chronic fatigue. That's because we're not getting the nutrients that our mitochondrial needs. So you can see how there's this, again, this interconnected web that it's not just, if someone comes in with thyroid problems, we're not just looking at their thyroid. And the reason is look at all the components that affect thyroid production and conversion. There's a lot going on. And so we can't just look at thyroid and go, oh, we're just going to give you thyroid medication and send you on your way. That's not fixing the problem. What we need to know is, well, what's contributing to this? Is it poor gut health? Is it poor, are the sex hormones affecting this? Are your mitochondrial or liver not detoxing properly? There's so many different things that play a part that this is what I really wanted to highlight, is that interconnected web that our body is. And so I hope that shined through. I hope it was interesting and fascinating to you guys as it is to me. I definitely nerd out on things like these where I just get excited to be able to learn and then share with others of, how our body works and why we need to be mindful of not only what we're putting in our body as far as food, but really being mindful of how our body is then interacting with that food and how our lifestyle is impacting our bodies. We can eat as healthy as we want, but if we have really high stress and we're not getting movement or exercise, then we're not really seeing the full picture. We're, again, only helping one area and not really focusing on that interconnected web that our body needs. And so it's really vital to, again, not only work on your nutritional approaches, but lifestyle and just mental, spiritual, emotional, giving yourself the grace and knowing that our bodies are complex and they need time to heal. And so if you are someone that is experiencing discomfort or chronic inflammation, knowing that look at all these things that play a part and all these puzzle pieces that have to be put together. So really giving your body grace and time to heal, and then realizing the impact that your own decisions and what you eat and what you do on a day-to-day basis really impact your body, and really trying to do what's best for it. So I hope you all enjoyed. I will see you all next time, and possibly either maybe a PowerPoint or a cooking class. I'll try to keep it exciting for you guys, but I hope you all enjoyed. Okay, bye.